Hi, my name is Sinead Madigan and it's an honour to present to you at the 2024 Australian Human Resource Management Conference. Today I'll be focusing on a critical issue affecting employees across Australia, particularly in the healthcare sector. According to Safe Work Australia, 39% of mental stress disorder claims stem from workplace bullying, harassment or violence. As HR professionals, it's our responsibility to support our teams, yet we often find ourselves searching for practical, effective strategies to address these issues. By the end of this presentation, my aim is for you to leave with an evidence-based strategy you can apply within your organisation to reduce bullying and foster a safer, more supportive work environment. We'll follow a loose agenda for the presentation, focusing on what is workplace bullying, bullying in the Australian healthcare sector, potential causes for bullying, and then evidence-based strategies to combat bullying. So what is workplace bullying? As many of you are aware, workplace bullying is a global issue, and the World Health Organization has classified it as a major public health problem. This is not a minor concern. It affects the well-being and productivity of countless employees across differing sectors. Workplace bullying typically involves long-term aggressive behaviour towards someone who finds it difficult to defend themselves. These behaviours are often repeated, abusive and offensive, creating an environment of intimidation and harm. It's just not the isolated act that creates the problem, it's the cumulative effect of these behaviours over time. The pattern of aggression leads to highly destabilising and distressing circumstances for those who endure it. Research indicates that bullying is more prevalent in the healthcare sector than in any other fields. This is largely due to the interpersonal and emotional demands of the healthcare field, the strict hierarchical structure in many healthcare institutions, and the often conflicting priorities within multidisciplinary teams. As human resource professionals, it's critical that we recognise these dynamics to implement effective interventions. Understanding what workplace bullying is the first step towards creating safer, healthier and more respectful environments for all employees. Bullying in the healthcare sector. Research has shown that bullying leads to lower job satisfaction, decreased workplace engagement, poor mental health and even suicidal ideation among healthcare professionals. More critically, these behaviours increase the risk of compromising patient safety. These aren't just workplace issues, they are serious risks to the wellbeing of both staff and the patients they care for. In a 2015 Australian survey, a shocking 25% of doctors reported experiencing workplace bullying within just the previous 12 months. This is not a marginal issue, it is widespread and the impact can be devastating. Junior doctors are especially vulnerable due to the rigid hierarchical structure of the medical profession. These individuals, early in their careers, often face not only the pressure of their demanding roles, but also bullying and, in some cases, sexual harassment from senior colleagues. This leaves them in an incredibly precarious position where asking questions or seeking guidance becomes difficult, hampering their learning and ultimately their ability to provide safe patient care. In fact, studies have revealed a troubling link between bullying and medical errors that could have serious consequences for patient safety. Known factors that contribute to workplace bullying. Trainee doctors are often finding themselves in a state of dependence on their supervisors. This reliance can create a significant power imbalance where the supervisory relationship becomes a source of stress rather than support. In such situations, the potential for both intentional and unintentional harm to the trainee's confidence is alarmingly high. It's crucial to recognise that this imbalance does not just affect the individual trainee, it can consequently affect the entire healthcare environment. Stress, burnout and excessive workloads are critical issues that lead to underperformance among supervisors. According to Pace and Smith, one way this underperformance manifests is through workplace bullying. When supervisors are overwhelmed, their capacity to lead and nurture junior colleagues diminishes, which can foster an unhealthy environment. When the demands of medical practice exceed one's capacity to cope and the stakes are high and mistakes are often not tolerated, the consequences can be dire. Healthcare employees who are experiencing burnout and feelings of alienation may, in their frustration, direct their anger toward junior colleagues. This behaviour creates a toxic environment filled with anger and disillusionment, which can stifle learning and growth. Research shows that victims of workplace bullying experience significantly more distress regarding their workload compared to their non-bullied peers. This distress not only affects their mental health, but also their performance and ultimately the quality of patient care. It is our responsibility to advocate for healthier workplace dynamics. We must create environments where trainees feel supported rather than threatened. This includes implementing strategies to address the cause of burnout and ensuring that all staff, especially those in supervisory roles within our healthcare workforce, are equipped with the tools and training necessary to foster a positive and constructive learning atmosphere. As HR professionals, you hold a pivotal role in not only addressing but also preventing bullying behaviour. With bullying impacting individuals' well-being, team dynamics, and overall organisational culture, it's vital that effective coping strategies are implemented to foster a healthier and more respectful workplace environment. First and foremost, we must ensure that interventions are put in place promptly. According to YOSIP, these interventions may involve skills development, cognitive problem-solving programs, and education on workplace violence. By equipping employees with the tools to navigate challenging situations, we're empowering them to address and prevent conflicts in constructive ways. These are proactive steps that can reduce the frequency and severity of bullying incidents. Equally important is providing support to victims. As Ariza Montez noted, offering support and implementing helpful activities that alleviate perceived negative impacts are essential aspects of intervention strategy. Victims of workplace bullying often feel isolated and powerless, and it's crucial that they know that there are systems in place that can help them recover and regain confidence. Prevention, however, starts at the top. Leaders play a critical role in shaping workplace culture. Mills emphasises that cultivating respectful and supportive work environments where leaders actively engage with employees, use positive communication approaches, and set long-term goals serves as a powerful deterrent to workplace bullying. HR managers should encourage leaders to model this behaviour, creating a ripple effect that fosters an atmosphere of respect and collaboration across all levels of the organisation. Hawkins also recommended encouraging staff to adopt problem-focused mechanisms and seek social support. By providing access to resources such as counselling or peer support groups, we can help employees mitigate the impact bullying may have on their personal and professional lives. Teaching resilience and promoting a culture where seeking help is seen as strength, not as a weakness, is crucial. In closing, I urge all of you to take a proactive and compassionate approach to addressing workplace bullying. The strategies we put in place today will shape the future of our organisations, ensuring they remain safe, respectful, and productive places for everyone.